So many of our members were at the March 5th meeting of the Kitsap Public Health Board when the report from Johns Hopkins was issued. Again, it's been about a year since it was commissioned, and our ears certainly perked up when we saw one of these top recommendations, which was to launch a formal commission to explore the feasibility of forming a public hospital district in Kitsap. It's something we've been looking into. So here to say, what is a public hospital district? So essentially, as you see up there is a full definition, but it's a community-created governmental entity that's authorized to deliver health services. There's actually 56 of them in the state of Washington, so that's more public hospital districts than we have counties. And despite the name, they're authorized not just to create or operate a hospital, but to deliver any type of health service to help people stay healthy, physical, social, mental. And about 1/4 of the current public hospital districts in the state don't operate or build a hospital. They offer other services. And because they're owned locally by citizens, they tailor their services to meet the needs of the community. So we have some examples in the packet that you can see, but I wanted to say a couple out loud. One is Kennewick, city of 85,000. They have a public hospital district that is called Two Rivers Health District. It offers a couple health services, but includes substance abuse treatment. And Snohomish County actually has 3 different public hospital districts. The first one does operate a hospital, but number 2 and number 3 don't. Number 2 is called Verdant Health Commission. It funds food security in schools, low-income dental needs, paramedicine programs, mental health. And number 3 is exclusively focused on substance abuse and mental health. So there's a lot of great examples of public hospital districts, not just operating hospitals. It can provide direct services, but it's really a funding mechanism as well. So we began exploring this, as Susan mentioned, about 2 years ago, and we've learned that, this isn't a panacea. It's not a cure-all for every healthcare issue we face, but it certainly can go a really long ways towards addressing some of our critically needed shortages. So how do you create one? Well, there's a whole RCW that outlines it, but in short, it's just a simple majority election. It can either be put on the ballot by petition or a majority of the county commissioners. It goes to the ballot, a simple 50% vote. Once it's created, there's then a separate election to elect commissioners. So these, typically there's about 5 for public hospital districts. The number can vary, but it's just like our fire districts, our ports, it's a board of commissioners that oversees it. And so just like any other agency, there is government transparency and accountability built into the process, and it's governed by the citizens. And how is it supported? It can get funding through a couple different mechanisms. The main way is through property taxes. So legally, the rate can range from 25 cents to 75 cents per thousand assessed values, but most PhDs assess in the low end of about 35 to 40 cents. And so noting that in Kitsap, if it was created at 35 cents per thousand assessed value, that'd be over 22 million annually in property tax that could go towards these critical healthcare needs.
Ask the first one. My question is about fairness. And so, we know that there are many entities in Kitsap County that should be providing the type of care that they don't. And now we have these gaps, right? DOD should be supporting more prenatal care, right? We should see those types of things. We also see that there are a mix of profitable and less profitable things that should be offered by maybe larger healthcare organizations in our county. And so if our public hospital district takes on these low profit needs, do we then just absolve the sort of requirement that we should be having for other entities that should be taking those responsibilities and moving it to the taxpayer?
Oh, no, absolutely not. I think part of the whole idea of a public hospital district is it's a community endeavor, and that doesn't let anybody off the hook. That doesn't let the Department of Defense off the hook, doesn't let for-profit providers off the hook. We need to work together. The commission develops a plan in collaboration with appropriate agencies throughout the county, and it needs to be something we all do together.
Okay, I saw Dr.
Just to jump in real quick, because the public hospital district commissioners are, elected by people, it's yet another voice folks have to hopefully collaborate with the entities like the Navy you mentioned, but also a strong voice when needed to stand up to them.
Dr. Watson and